last 2 weeks, especially during our two visits of the two mental health community centers, one of the most striking things we witnessed was not only a reform of services, but also a reform of philosophy in mental health care. Traditionally, mental health systems relied heavily on large psychiatric hospitals and long-term institutionalization. Care was often centered on diagnosis, symptom control, and separation from everyday community life. In many cases, people with severe mental illnesses had very limited autonomy and social inclusion. What we saw during our visits to the community mental health centers here in Prague represented a very different approach. These centers are one of the key pillars of the reform we've heard extensively about in the last 2 weeks. And the change in philosophy and attitude was present among the staff, the interior and exterior design of the centers, and every little detail one could think of, from highly trained mental health nurses working closely with social workers to comfy cushions in the waiting rooms. I mean, changes were everywhere, simply. And instead of only asking, what illness does this person have? Now the system seems to be increasingly asking, who is this person and what does this person need to live a meaningful life? The most pronounced feature of these centers to us were the voluntary nature of the services, the multidisciplinarity of the teams, and the community-based support. You will hear example of these shortly as we go on. Another major shift was the emphasis on human rights, dignity, recovery, and partnerships with service users. The goal simply seems to be not only stabilization, but also social inclusion, independence, employment, relationships, and even quality of life. For us as visitors, these centers demonstrated that mental health reform is not only about changing buildings or services, it is about changing attitudes, from institutional care toward a person-centered, rights-based community care. That was very much present because all of us seemed to feel cozy and comfortable in whichever center that we visited. One of our guides said something very interesting, that the challenge of the reform is not only a shortage of financial resources, but a shortage of right people with the right attitude.
Valentina, and I would like to share a little bit more about our experience in mental health center in Prague. What I was truly impressed by was the way they organized their work around every client. What stood out most to me was the collaboration between the different professionals. So many specialists are actually involved in supporting a client, but at the same time, they don't work separately. They work as one very well coordinated team. What made this especially clear for us was a huge whiteboard that shows how different professionals communicate, share responsibilities, coordinate their work around each client. And it was a very simple but also very powerful way to show how their collaboration really works. What I found most valuable also is that within such a well-structured system, the individual person still remains the center. The approach is not about one size fits all, but rather each client needs, specific situation are carefully considered. And when we talk about multidisciplinary, we really mean it, because they even had a therapeutic dog included in the process, and it was very cute, and I found this both very wonderful and powerful. This visit was inspiring to me because it showed how mental health can be both highly structured and organized and very deeply human at the same time. Thank you.
Hi, my name is Nora, and I will talk about the multidisciplinary teams that we met in mental health centers. This was part of the reform to form teams that combine both social and healthcare professionals. They work side by side as one team, and a client has case managers in both professions. They share information in team meetings, and also in team meetings, you're able to have advice and insight from other professionals. Some of these centers even have one system for client records which can be accessible by all team members at any time needed. This reduces gaps in communication, and I find it quite client-friendly. Also, the benefit of these teams is that they can answer clients' various needs on time and more accurately. They're able to adjust to these various needs that a client might have, even finding employment, connecting with resources, finding social connection, psychotherapy, or medication. We learned that forming these teams took some time and effort, but they seem to be working really well at the moment. And I think we could learn a lot of this in our country.
A few words about the assessment of the potential clients. To be involved in this type of service, a person usually needs not only a formal diagnosis, but also significant difficulties in everyday functioning. This can mean problems with maintaining work, housing, or social relationship. The first contact with the center typically involves a joint meeting with the psychologist and the case manager. During this initial assessment, they evaluate the person's mental health status and social situation and needs. One of the tools used in the assessment process is the Modified Global Assessment of Functioning. This scale helps assess a person's level of functioning in daily life from a psychological, social, and occupational perspectives. The scale ranges from 0 to 100 points, with higher scores indicates better functioning. Clients are admitted to care if they score below 60, which indicates at least moderate symptoms or difficulties. Based on the assessment, the team decides whether the person meets the inclusion criteria and what kind of support would be most appropriate.
Crazy, so what? Each one of us has their own mental health experiences, so why not share them with others in an honest and open way? That is what a peer consultant or a peer worker does in different settings as a school community services. They share their mental health experiences, provide hope, shows ways towards recovery, debunk myths. That's why they are a key and valuable figure in the multidisciplinary team and in the mental health community system.
Well, yes, they actually use electroconvulsive therapy in specific cases when other forms of treatment, such as psychopharmacological medication and psychotherapy, have not achieved the desired results during inpatient and outpatient treatment. In agreement with the client, people suffering from severe forms of depression or schizophrenia may decide to undergo this type of therapy. However, ECT is not available in all hospital departments treating people with mental health difficulties. The equipment required for administering the therapy is extremely expensive, and the procedure requires highly trained professionals, including psychiatrist, an anesthesiologist, and a nurse. The treatment itself is carried out in several stages over the course of multiple weeks. And according to a psychiatrist and a nurse we met, the effects of the therapy can sometimes be truly remarkable. Although I was already aware that this type of treatment is part of modern psychiatric approaches, it was very meaningful to see that it is actively used and not only discussed in the theory.
Hi everyone, I'm Constantina, and during our visit to Focus, I focused on a key role in the rehabilitation process, the IPS specialist. IPS stands for Individual Placement and Support, and it's a proven model that integrates employment into mental health recovery. So what does an IPS actually do? Their primary mission is simple but vital. They help individuals find and keep a job and focuses on a place, then train approach, ensuring that the job matches the person's unique preferences and strengths. The specialist provides hands-on assistance every step of the way. This includes the CV. They help craft professional CVs that highlight the candidate's skills. The negotiating employment terms with companies to ensure a supportive work environment, and the documentation. They guide the clients through the preparation of all necessary documents and paperwork. In short, the IPS help individuals regain their independence and sense of purpose.
Hi, I'm Mario, I'm from Italy, and I'm going to talk to you about how caregivers take actually care about themselves. We have to say that in Czechia, as in many countries, caregivers often dedicate so much energy to supporting others that they risk neglecting their own mental health. Self-care for caregivers it's not selfish, it is essential. Psychological support, peer groups, moments of rest, healthy boundaries, and access to mental health services can help prevent burnout and emotional exhaustion. Taking care of oneself allows caregivers to remain emotionally present, resilient, and effective in caring for others. Even as we saw in the clinic in which we were, through caregivers, we saw that they were able to make that non place a really place because of their genuine relationships. So they're able to make a healthy care place a real place because they are genuine connected one each other, working together and making their space comfortable, sharing time to rest and also to understand the role they have and when they have not their role anymore. For example, during the breaks.
Recovery does not mean a cure or the complete disappearance of all the symptoms. Mental illnesses may remain part of a person's life, but they do not have to define who they are or prevent them from living a meaningful and fulfilling life. Recovery means learning to live well alongside ongoing challenges, while building stability, resilience, and hope for the future. The focus is not only on reducing symptoms, but also on helping clients develop coping strategies, strengthen everyday functioning, and regain confidence in their own abilities. Clients are seen as whole individuals with relationships, with interests, values, and personal goals, not simply as diagnoses. The center works collaboratively with the clients and, when appropriate, gradually prepares for ending the cooperation once the client is functioning more independently. This process is always based on shared discussion and mutual agreement. At the same time, the goal is to avoid long-term dependence on services and to support clients on building autonomous lives. If support is needed again in the future, clients are always welcome to return.
blood running in my body. I have a soul still in place with mental health issues, but I'm still functioning. Why must I be less human than you? Oh, I have blood running in my body. I have a soul still in place with mental health issues, but I'm still functioning. Why must I be less human than you? Oh, we all the same. It doesn't matter what scale you use, we all the same. So do not look down on me. Oh, we all the same. It doesn't matter what scale you use, we all the same. So do not look down on me. I am just like you, only that my path meandered. Not because I wanted, yet somehow, someway, it came all the same. My story, should my story define me? Why do you define me by experience I never chose? When the sun finds me, just like you, I do not know where you stand, and I'm not here to point at you, but simply to draw your attention that I'm no different from you. Like the trees, they come in different shapes and forms, different names you don't want to count. One thing is for sure, they are all trees. Oh, think of the birds of different breeds, those that fly and those that walk, their names vast, unique, but all remain birds. And so it is with people, each carrying unseen weather, different minds, different battles, different ways to survive. Yet beneath every label and every fear, consciously and unconsciously, we remain human. So anytime you see me, one truth must register: I am just like you. Only that my story changed a bit. We are the same. It doesn't matter what scale you use, we are the same. So do not look down on me. We are the same. So do not look down on me. We are one people. We are susceptible, but we accept that we together bless.
Take care of the one you love. Take care of the one you need. Take care of the one who needs you most. Take care of the one you love.
Galio wahanzao wasihendro wote wa hukumu